Hey everyone, this is Rick MacDermid here with Senior Solutions Group, and thank you for taking the time to check out this video. If you would like to subscribe, please do so and share this with a friend. We have seen a pattern over the last couple of years with Medicare Advantage plans consolidating across the country. Millions of people either a year ago or this coming year are going to have to find a new plan, either because their plan is leaving or the hospital that they like the best is no longer accepting their plan. Here locally, our main hospital is no longer going to accept, for the most part, PPO plans, which is kind of interesting because PPO plans allow you to go in and out of network. So you pay a higher cost if you go out of network, but you have the flexibility. We are seeing the consolidation of plans, plan networks, hospitals that are only working with a certain subset of Medicare Advantage plans, mainly because they have more administrative costs in general with Medicare Advantage plans dealing with prior authorizations. So if they can minimize the prior authorizations or streamline that process and maximize the money they are getting for the services they offer, that is their goal. Medicare Advantage plans are being put in a box, as well as standalone Part D drug plans, by the federal government's Inflation Reduction Act that was signed by Joe Biden in 2022. So that box basically has shifted the majority of the cost of the high-end drugs once your drugs exceed $2,100 in 2026. So who's going to pay for that? Well, in 2023, the insurance companies were only on the hook for 15% of the cost. In 2025, they're on the hook for 60%. That is a 3-4 time increase. Their risk is 4 times greater than it was just a few years ago. So what is going to happen? Who's going to pay for all of this? Because the doctors are prescribing Ozempic like never before, and the insurance companies are having to pay like never before for these drugs. So the lower the cost to you, the higher the cost to the insurance company. If the insurance company is required to pay 60% of the cost, and the government used to pay 80%, now they're only paying 20% of the cost. Well, the insurance company is going to take away benefits or just cancel the plan entirely, or stop compensating agents like us. So they're going to say, well, the plan is still available for the consumer, but if you sign them up for that plan, you're no longer going to be paid for that plan. Okay, we want to do what's best for the client anyway, so we're always going to recommend what's best for our clients. But we have fewer plans to work with. With consolidation, it becomes more of a challenge to make sure that your network doctors are covered, your hospital's covered, and the essential benefits are covered. So we're seeing fewer of these extra benefits. A year ago, there was a carrier that had reimbursement for you to go to a national park. I mean, that sounds really good, but it wasn't an essential health benefit. Medicare stepped in and said, no more of that. Now we're seeing insurance companies that are being put on the hook for these high-end drugs. They're reducing some of the extra bells and whistles like dental. They might be taking away other benefits such as over-the-counter. So getting free cough drops may not happen anymore. Free toothpaste may not happen anymore. So if you're on a plan that offers that, you can stock up between now and the end of the year. What are you going to do moving forward? You got to have a game plan. You can't just assume that your plan is going to be the best plan moving forward. Look at your annual notice of change that your plan gave you. Make sure that your plan providers are still in network for next year. Here locally, our hospital, MultiCare, is no longer going to accept PPO Medicare Advantage plans except for one carrier. They're making an exception. Well, just the other day, they weren't even going to accept that carrier. So it's a very fluid situation. You really need to know all of your options. Should I consider moving to another plan? Maybe, just maybe, should I look at going back to original Medicare? But then you got to find out if you qualify for a Medigap or a supplemental plan based on your pre-existing health. You may or you may not. If you don't have an agent, you need to find one. Or if you're a do-it-yourselfer, plan to spend a lot more time on this than you have in years past. If you'd like to reach out to us, we are here for you as well. We are a Senior Solutions Group, and we'd love to help you if you need our help. Take care, have a great rest of your day, and if you found this information useful, please share it with a friend.